Welcome back to the Medcurity podcast. Today we are talking about a key part of the HIPAA security rule, and that is your administrative, physical, and technical safeguards. By the end of this episode, you are going to understand what each of these categories means, how they all work together, and what they actually look like in day-to-day healthcare operations. So let's simplify it. HIPAA doesn't give healthcare organizations a single checklist of tools to install. Instead, it organizes protections into 3 safeguard categories. Why? Because protecting patient data isn't just a technology problem. It's also about people, processes, and environments. Think of the safeguards like layers of protection. Each layer catches risks that the others might miss. Those layers are administrative safeguards, physical safeguards, and technical safeguards. So let's walk through each one simply and practically. First, administrative safeguards are the policies, procedures, and decisions that guide how your organization manages security. In simple terms, administrative safeguards are about leadership, planning, and accountability. So they answer questions like, who is responsible for security? How do we train staff? How do we respond to incidents? And common examples of these kinds of safeguards might include your security risk analyses, your policies and procedures, your staff training programs, your access authorization processes, incident response plans, or sanction policies. So there's an important mindset shift that we have to reach. Administrative safeguards shouldn't live in a binder. They should live in how your organization operates. If you have clear policies and defined responsibilities and documented processes, then you are already practicing administrative safeguards, even if you've never called them that. Physical safeguards protect where patient information exists, and that includes buildings, rooms, devices, and physical access points. Physical safeguards are all about controlling who can physically access systems and data, and these might look like locked offices or server rooms, badge or key access, screen privacy filters, secure device storage, policies for lost or stolen devices, and visitor sign-in procedures. Physical safeguards matter because a lot of breaches that happen aren't high tech. They happen because of a lost laptop or an unlocked workstation or a device that was left in a car. HIPAA expects reasonable protections based on your environment. And technical safeguards are what most people think of when they hear the word cybersecurity. They protect how systems and data are accessed and used. These are the safeguards that are all of the tools and configurations that secure electronic systems, such as unique user IDs, multi-factor authentication, password policies, encryption, audit logs, automatic log-off, firewalls, and antivirus tools. But here's the key. Technology alone doesn't make you compliant. A system can have great features, but if passwords are being shared or access is not being reviewed or settings aren't configured that should be, then your risk remains. So technical safeguards work best when they are paired with strong administrative and physical safeguards. So let's bring all of this together into one simple example. Let's say you have a laptop that accesses electronic protected health information. The administrative safeguard here is that you have a policy that requires encryption and prohibits shared logins. The physical safeguard is that the laptop is stored in a locked office when it is not in use. And then the technical safeguard is that the device requires a password, uses encryption, and locks automatically. If one layer fails, then the others help protect that data. And this layered approach is why HIPAA uses safeguard categories and not checklists. So here are a few quick clarifications. You don't need every single safeguard. You need reasonable and appropriate ones. Addressable doesn't mean optional, it means flexible. Small organizations still need all 3 safeguard types, and documentation of what you're doing matters just as much as implementation. HIPAA is about intentional protection. So here are 3 simple actions that you can take right now. Number 1, review one policy and update it to match reality. Number 2, take a walk through your physical space and note risks. And number 3, review who has system access and why. These small, consistent improvements will add up quickly. Administrative, physical, and technical safeguards aren't these abstract compliance terms. These are practical tools that help you protect patients, support staff, and reduce your organizational risk. So if today's episode helped to clarify identify those safeguards, then share it with someone on your team. And if you want help organizing and tracking safeguards in a way that is clear and sustainable, Medcurity is built to support you. Thanks for listening, and we will see you next time on the Medcurity podcast.